at Remar Review, we like to call this Facebook episode, this YouTube episode, Let's Talk NCLEX, and most importantly, Motivational Monday. If you are a nursing student, a nursing graduate, and you are preparing for your NCLEX exam, this is the place for you to be on your journey to getting that nursing license. Oh, at Remar Review, we are the only place, hello everyone, we are the only place where we're providing you weekly, real-time motivation here for nursing students all over the planet. Hey, again, this is Motivational Monday and Let's Talk NCLEX. If this is your first time here, you may be surprised to know that I am Regina Callion, and I am also the #1 NCLEX instructor on this planet. And I have the pleasure of working right here at Remar Review, helping the #1 nursing students get their state license. Hola, bienvenido a mi canal. This is Remar Review. So we have an amazing episode here. I mean, I'm telling you, I have the information that you guys wanted about Remar Nurse University. We also have brand new Remar nurses who have taken the opportunity. Taken the opportunity to, it's not a word, to give real testimonials talking about the struggles that they have overcome. This is always the most inspiring part of Motivational Monday, is just hearing the real stories. These are not paid actors. These are not paid celebrity endorsements. These are Remar nurses that are coming to tell you, I did it, you can do it too. And also, hey, we have the information that you need to pass your NCLEX with our hot NCLEX questions. So shall we get started? I'm so happy you're here. Orlando is representing in the house. We have nurses from all over. I dare not say rep your city right now, because I know we will get an influx of cities, states, continents, countries. It'll be a beautiful thing. So we are going to get started. Because this is one of the shows that you will want to keep on your playlist. All right. If you are a Remar nurse and you're watching on Remar Nurse Radio, or if you happen to see this episode on YouTube, you will enjoy listening to it over and over again. Puerto Rico is in the house. New Jersey is in the house. Darla, I'm happy that you are here. Everyone who takes time out of their week to come and listen in on Motivational Monday, Let's Talk NCLEX, thank you so much, because you are investing in your future education, and there's nothing better than that. I appreciate Dinah from Orlando. Ohio is here. Hey, Columbus, Ohio, my neighbor. Thank you for being here. Kathy from Seattle. Always gotta respect Californians who are on the broadcast, because they have to get up so much earlier. They have to really arrange their schedule, because this is an Eastern program. All right, so here we go. Our motivation for this week, I love it, Marlene. I love the Bronx is in the house. Our Motivation Monday topic is helping yourself by helping. Oh, this, usually for Motivational Mondays, I'm on here and I'm like, let's go. Focus on your own business. Mind your own business. But this week, through my own personal experiences, I have had the pleasure of helping. And so I was actually motivated, and actually I got more done by helping other people this week. So I'm just going to share my personal experiences from you guys, because the things that I share actually come right from my own life and are very transparent to who I am. So don't forget, the whole year of 2019, we are paying for NCLEX exams. Yes, we started this promotion, as you guys know, the beginning of the year. And every week we pick a new winner, a brand new winner, and we will actually invest the $200 to allow them to sit for their NCLEX, simply based off of the fact that they have invested in themselves by purchasing the DVD self-study package. So not only are you getting great information with the DVD Slow Study package, but you also have the opportunity to get it reinvested back into yourself with the free NCLEX exam. So shout out to the Read More Nurse community, because giving has been something that you have encouraged us to do as a company. So I love how we learn from each other, we grow from each other. Check out the new testimonials. It's testimonial time. It's testimonial time. Hey, I have Nurse Ronaldo Lewis. He posted a video to the Remar for NCLEX Facebook page, our public page. And it was a short video, like literally one minute. And he said, Remar helped me. Remar helped me pass NCLEX, and he said the quick facts is the key. The quick facts is the key. And y'all know how I love my quick facts. But just to hear him shout it out as like, this is the key that you need, know this book, was pretty special. And I appreciate him. And congratulations on your new nursing career, because you have the opportunity to do anything with it. I sit in front of you, and I literally have been all around this planet with a nursing degree. So I'm expecting the same things from you guys. Pass NCLEX, congratulations again, Nurse Ronaldo Lewis. I have to tell you one more testimonial, and I'm just in love with this video. Nurse Davion Cooks. She is a new PN. Oh my goodness. She is a repeat test taker. I love the very beginning of her video, because she started it with just where she was. She was about to start nursing school, and it was her daughter's birthday. And let me make sure I get this right. It was her daughter's birthday, and her father passed away on her daughter's birthday. And it was a surprise. Of course, it was a tragedy. And she questioned, like, can I go through nursing school? Can I even go through nursing school with this event that happened? And she decided to give it 100%. She did very well in nursing school. I think she graduated like at the top of her class. And as she prepared for her NCLEX, her story was like, I didn't take it serious. I thought I could just use my nursing notes. And many of you, as we come upon Remar Nurse University, a lot of you new graduates, you've never encountered a test like NCLEX before. And you must take it serious from the very first time, because Nurse Cook, she says, I didn't take it serious. I thought I was just going to review some notes. I think she said she like some notes from another program. I don't know if it was ATI. I can't remember. However, she went into the exam wholly unprepared, and so she didn't pass. And she was kind of like, wow, I didn't pass. I did so good in nursing school. This is a very common story. I did so good in nursing school, but NCLEX was just a different type of animal. And so she heard about Remar. She got the quick facts. Love the quick facts book. Thank you very much. Shouted it out. And she studied the quick facts book, but I think, again, she said her distractions distracted her. She said, I had so many distractions that distracted me. And so she didn't pass her second time. She didn't. And where many people would have said, you know what, I taken this test twice, and I'm not going to try again. I'm not going to waste time. I'm going to do something else. She said, okay, I didn't pass the second time, but I'm going to go back and do this thing again. I'm going to try again. I'm talking about Nurse Cooks. She said, I'm going to try again. And she got the full DVD program. Yes, she did. She said she invested in herself, and she literally said, this is the best NCLEX prep on the planet. I'm paraphrasing. It's the best NCLEX prep. She said, no, this is what she did say. She said, I learned more in 6 weeks than I did in 2 years of nursing school. Can somebody testify to that? That is an amazing testimonial for somebody to say, in my LPN program, 2 whole years did not compare to the 6-week program. That is incredible. That is incredible. But it also speaks to just the content. I only focus on the content in that program. I am not trying to impress you guys. I don't have to go around the world to make one point. I just want you to know what you need to know. So, man, she learned more in the 6-week program than in her entirety of nursing school. And, you know, that's a really good testimony to what the Remar nurses are embracing. Okay. So third time, this is the motivation right here. Man, this is the motivation. And really, most of the time, I just want to stop because the Remar nurses' stories, they are so good. They are so good that really it's all the motivation that you need. So let's get charging. Let's get going. And I'm here. Okay, so I have a testimonial. Let me just read this. To you. If I can. I don't know if I can. I don't know if I can read it. But anyways, I see it. For those of you that are passing and testing, send me a video. Send me a video because we love to use them to encourage and motivate the next Remar nurses that are coming on. All right, the next Remar nurses that are coming on. All right. So I'm going to go as much as I can today. Let's get started here. Oh, her best advice. I love this. I had to share this as well. A whole nother point for Nurse Cooks was God plus investing in yourself. That's what she wanted you to leave with. If you have God plus investing in yourself, you will be a Remar nurse. So that just means perseverance. She said she couldn't get through her exam without prayer. She cried her way. I love it. She cried her way through the test. She prayed and she cried and she prayed and she cried. And they must have been looking at her on the cameras like, what's going on with this girl? But she got it. She got it. All right. So really quickly, I know you guys see the t-shirt. I know you see the paraphernalia. Remar Nurse University is rolling on in. We are rolling on into May with Remar Nurse University. I do want to let you guys know that there are hundreds of you who have signed up to participate in this live NCLEX review. The live NCLEX review, again, is totally free. I'm going to go back. We're going to talk about it at the end of the program. But you know what? The workbooks are in. For those of you who have purchased the workbooks to watch the lectures, those even purchased the workbooks, they are in. They are going out today. All right. So your workbook bundle is going out today. I know you guys are really happy. Okay. You're going to be getting them in the mail this week. So I promised, as promised, we worked really hard. The 15th, we said we would have them out and ready for you guys. So we will. For you guys who don't know about Remar Nurse University, it's okay. Remar Nurse University is our free NCLEX review. It's 2 hours, okay? It's a 2-hour review every Monday night in May. Every Monday night in May, we will be giving you guys that information. And for those of you who have been around since last year, you know, we only do Remar Nurse University once a year. It takes a tremendous amount of effort and teamwork and production and expenses for us to put on this free NCLEX review for the Remar Nurse community. So I just encourage you guys, don't miss it. This won't ever happen again for 2019. So take part, sign up for Remar Nurse University. And again, you can sign up for free. Okay, you can sign up for free, but if you want that workbook that I just showed that has the case studies, the homework, the practice exam, the lecture notes, it's $25, okay? And it comes with the t-shirt and the workbook and the tickets and the discount for the package, all right? So keep on watching, keep on showing up. The best is yet to come, and at the end, we'll get on, all right? So let us get started with Last week we talked about accepting responsibility. That was the challenge. That was the challenge for us, accepting responsibility. This week we have a new challenge, right? And the new challenge is turning your attention not on yourself, but outward. In other words, helping somebody else this week. helping somebody else this week. Let's just try it. Let's just try it for motivation. Let's just switch it up, reevaluate our priorities, and focus on somebody else. So my examples are a scarf, Arthur, and Janiyah. And of course, you're like, what is this? A scarf, Arthur, and Janiyah. So these are just my examples of things that really blessed me and motivated me this week. The first thing is a scarf. So this is me. And actually on Saturday, I went to a baby shower and I had on this outfit. I had on like a Remar blue sweater. And then I had a scarf. It was a brand new scarf. I had never worn it before, but it was kind of fancy or whatever. So I'm at this baby shower. And a single mom came up to me at the baby shower and she said, wow, that's a really pretty scarf. You know, I wish I had one like that. And immediately I just said, you like this scarf? You can have it. And I took it off and I said, here, you can have it, take it. And she's like, no. And I'm like, no, really, take the scarf. Like, it's yours. And so she took it and she put it on and she wore it. And for me, myself, it was such a blessing to be able to give and not give begrudgingly, but literally just give freely because it would bless somebody else. And because I was able to fulfill a need very easily. You know, if somebody comes up to you and they compliment you on something, and you know they probably couldn't afford it or they would really be appreciative, consider just giving it away. Because just as you gave that thing to another person, somebody can come along and bless you. But I think we have to be in the mindset that material things in our lives come and go. But what really matters is how we treat one another, how we show our love. You know, if you're a Christian, how do you have the character of Christ who gave so freely without expecting anything in return? I think that's the challenge. It's like, you know, when you are able to give without the expectation of ever receiving anything, that's where your blessing is. And so as we are persisting with our journey to nursing, our journey to get our license, yes, we are going to have this amazing achievement. We're going to be licensed nurses. But is it all about us? Or should we be anticipating the ability to bless other people with our knowledge, with our care, you know, with our ability to empathize with others who have illnesses? And so that instance really blessed me. Also, Arthur, I was coming out of work one day with Janiyah, and Arthur was walking down the street. And Arthur saw me getting into my car, and he came up to me and he said, hey, young lady, I was on my way to get some food and I realized I didn't have any money. So I was just wondering, do you have a couple dollars to spare? And so usually I'm a little hesitant when people walk up to me asking me for money. I'm a young woman. This guy was a tall man, you know, and he was very intimidating. He obviously, you know, was homeless or didn't have shelter, and he was asking me for money. So in an effort to diffuse my stress, I began to talk to him. And so I said, Arthur, no, I didn't even know his name. I said, what's your name? And he said, oh, my name is Arthur. I'm a songwriter. And I said, oh, that's interesting. And then he said, well, would you like to hear me sing? And I was like, well, okay, yeah, if you want to. And so he started singing to me and just telling me how beautiful I was and how happy life was. And I said, man, Arthur, what are you doing out here asking for money? What's going on? What do you have, a drug addiction? What's going on with you? Why are you out here asking for money? And he basically said, no, I don't have a problem with drugs or alcohol or anything like that. He said, I just fell on some hard times and I don't have money now. And I thought, wow, how amazing this situation is where I'm able to meet a new person. And instead of me shrinking back and saying, no, you know, get away, I don't have any money, get away, like opening up a conversation and a dialogue where I was out there talking to Arthur and he told me, you know, really his story. And what I walked away from when I got in my car, I walked away and realized that, you know, the only difference between me and Arthur is probably a few bad days, if I get hurt, can't work, can't speak, can't write, how closed off will my finances be, and that's really how we should be looking at people that we see who have less than us. They're really no different from us. At the moment, at the present time, we just find ourselves extremely blessed. So that was Arthur. And I said I was coming out of work with Janiyah when I met Arthur. So maybe some people was like, well, who's Janiyah? So I get to introduce Janiyah to you guys. I love Janiyah. We're talking about Motivational Mondays and helping other people. Janiyah is a future REMAR nurse. She's a future REMAR nurse. She's actually 12 years old. And I have essentially taken her underneath my wing, and I'm training her to be a nurse right now. It's kind of like a pilot study because I've never done this before. But Janiyah is an exceptional child to me. She has experienced a tremendous amount of, trauma. I like that. Yeah, she's experienced a tremendous amount of trauma growing up. Just a little small background, her father is in and out of prison. She actually lost her mother. Her mother was violently murdered last year. And despite all of these challenges and all of the things that she is growing up with, I see this child every week at church. And she has a resilience, and she has a smile, and she has, an ability to be able to adapt to this environment. And so when I see her, she's so beautiful. It's like watching a rose grow out of concrete almost, like she has the potential. If she has that kind of strength to lose her mother, to grow up in an environment that, most people probably wouldn't call ideal, but still persist, then imagine if she harnessed that strength into something positive, just like you guys. Imagine if all the traumatic things that you have experienced, imagine if you allowed that to build up a strength, build up a reserve, build up a character. And so I have essentially, I'm training Janiyah to work with her mind early. And she's so brilliant. I mean, she went from, like most of us in nursing school, when you get there, you really don't know about your body, the body you've been living in for years and years and years. You don't really know the aspects of it. Janiyah's the same way. She didn't know the organs. She didn't know how many kidneys you had. And now she is very proficient. And we do things like coloring. We color the body. We talk about it. And we are, investing in her future right now. I'm teaching her to invest in her education. So giving without expecting something or someone to give back to you is a principle that I think we have to embrace this week, because there's a big responsibility for all of the knowledge and all of the wisdom that you have. The only things I think that we can pass down, the only things that you will leave when you leave this earth is going to be your knowledge that you had. You can share that with others. Your love, people can feel the love that you had for them. They can feel the wisdom that you gave them. All right. So here we go. That's our motivation. That's our challenge to you guys. I like this quote here. It says, you have two hands, one to help yourself, the second to help others. Okay. You have two hands, one to help yourself, the second to help others. So don't you guys forget that. Don't you forget that. You're extremely blessed. Okay. Extremely blessed. Now, as we proceed into the next phase of this wonderful event, it's time for Let's Talk NCLEX. Are you ready for NCLEX questions? We're going to focus on delegation in the beginning. And I like to think that this Let's Talk NCLEX is foundational things that if you graduated from nursing school, you should get every one of these right. If you find yourself not getting these questions right, you definitely got to go back and review. Okay, period. So I'm looking for a perfect score from everybody watching today. That is the challenge. Let's go. Let's go. A registered nurse is preparing to admit a client with a seizure disorder. Which actions can be delegated to an LPN/LVN? Okay. 1, padding the side rails of the bed. 2, completing the admission forms. 3, setting up oxygen and suction at the bedside. Or 4, placing a tongue blade on the assessment table. What say if you guys? We're looking for the action. We're looking for the action that can be delegated to the LPN for a client with seizure disorder. Yes, this is a live recording right now. You're watching it live. All right, I got threes coming in. Anybody else want to answer anything different for what that LPN should be doing? LPN in many states, LVN in California. Okay, I got some ones answering number 1. I see you guys. Padding the side rails of the bed, setting up oxygen and suction at the bedside. It's a showdown between these two. But the correct answer, I like that, Nurse Melissa. The best answer is going to be number 3. Setting up oxygen and suction at the bedside is going to be the most appropriate, okay? And if you picked 1, padding the side rails of the bed, well, that is no longer going to be appropriate. J. Cole really doesn't want nurses to do that because it can potentially be a dangerous situation for the client. Can anybody tell me why padding the side rails of the bed is dangerous? What's the issue with that? That could be your homework. Look that up if you don't know why that's an issue. All right. 2, completing the admission forms. We're not going to have the PN do that. We're not going to have the PN do the admission forms because that is a registered nurse activity, right? There's assessments that need to be taken. And then the last one says placing a tongue blade. Placing a tongue blade. Oh no. Why is that just crazy? You're not going to do that. That's just dangerous too. We don't put anything in the mouth. All right. We're not going to put anything in the patient's mouth at all. Just for NCLEX, just stay away from that. Just don't even pick it. Let's go over let's quickly review the seizure precautions. Since some of you, you didn't get it quite right, that's all right. The seizure precautions, just a quick review. If a patient is in an active seizure, you want to stay with that client during the seizure. One of the most important things you want to know if you have a client with a seizure disorder and they're having a seizure, you want to know how long is that seizure lasting, all right? Because that will help the doctors be able to categorize what has happened, because 100 times out of 100, the doctors won't be there and they'll be looking for the nurse to explain to them what is happening. So I was doing an admission one time with a client. They started to have a seizure. The first thing I did was look at my watch because I needed to know, okay, the seizure lasted 13 seconds. If you're a nurse working in the hospital with patients, you should absolutely have a watch on your arm. You need a watch with the second hand no matter what. All right. Also, so you stay with the client, you turn the client to the lateral side. In the event of a seizure, if it's left lateral, right lateral, I don't think that's the most important. Noting the time definitely is, but turn the client to the side. Don't put anything in the mouth. Don't try to restrain the patient. Allow them to be free. Also, have oxygen and suction available at the bedside. Okay, so just a quick review on seizure precautions. These things are found in your quick facts book. If you have it, refresh yourself with the topic. All right, let's go on. Let's try this question. Let's try this one. Here we go. A licensed practical nurse is supervising a student nurse, okay, who is performing tracheostomy care. All right, that's fine. All right, performing tracheostomy care. Which action Which action by the student would cause the nurse to intervene? Okay. Number one, share this video as well. Come on, share this video. We will keep it going if we get, how many shares, Mark? 2 more shares. All right.
2 more shares.
Okay, here we go. 200 shares. All right. Removing the inner cannula and cleaning using standard precautions. 2, replacing the inner cannula and cleaning the stoma site. 3, removing old dressings and cleaning off excess secretions. 4, suctioning the tracheostomy tube before tracheostomy care. Which are we going to intervene if we see a nursing student doing this? Number 1 says removing the inner cannula and cleaning using standard precautions. 2, replacing the inner cannula and cleaning the stoma site. 3, removing old dressings and cleaning off excess secretions. Or 4, suctioning the tracheostomy tube before performing tracheostomy care. Oh, I love it. I love it. You guys showed up today. Love Kiki in the house. Nurse Melenos, hi. You know the answer here. Oh, yes. Nurse Gretchen, Nurse Kathia, you guys are getting it all perfect. So I appreciate you all answering so rapidly. Oh my goodness. I appreciate you guys answering so rapidly. The correct answer is going to be, number 1, you have to. If you are working with a tracheostomy, you know it has to be sterile precautions. Because this is just such a place for bacteria to really do some serious harm to your client. So we definitely would want to have that nursing student using a sterile field. No questions asked about that. Yes. All right. Don't worry. No question marks here. You guys got it. Okay. We have another question coming up. That was too easy, I think. I feel like that was too easy. Let's try this question. Here we go. Okay. Here we go. Which client would be the most appropriate to assign to a LVPN, LVN under the supervision of an RN? All right, so here we go. Number 1, a client who needs central line insertion for chemotherapy. 2, a client who needs antibiotics for a GI infection. 3, a client with severe anemia due to placental detachment. Or 4, a client who needs preoperative teaching for an appendectomy. We got 4 clients here. Oh, the answers are coming in and they are controversial. When I say controversial, I mean different. Everybody's picking different things. Looks like it's a showdown between 2 and 3. Okay. All right. Now remember for the LPN, we need to understand that the RN is supervising the client, but it's the LPN who will be spending the majority of the time with the client. Yeah. It's the LPN who will be spending the majority of the time with the client. So who should that client be? Is it the one who needs a central line insertion for chemo? Yes, probably not that one. But we have 2, either a client who needs antibiotics for a GI infection, or 3, a client with severe anemia due to placental detachment. What is that? You even know what that is? Or 4, somebody who needs preoperative teaching for an appendectomy. Let me do this. Can LPNs do teaching? Do LPNs teach? Can they do teaching? That is the question. Somebody tell me, can your LPN do teaching? This is question number 3. Can the LPN do teaching? That's all I want to know. That's what I want to know right now. Can the LPN do teaching? What do you say? What do you say? No, they can't. They can't. No. Everybody's saying no. I'm shocked. I'm shocked at this. Okay. No teaching for the LPN. That's not true, guys. That's not true. You guys know the LPN can do teaching. What kind of teaching? Let's qualify it. The LPN can do your follow-up teaching. Yes, don't forget, your LPN can do follow-up teaching. So don't let NCLEX trick you with that. They can do reinforcement. They can do follow-up. So it's very particular. You got to watch those kind of questions, okay? Yes, they follow up. Follow-up teaching, they do. All right. So let me give you guys the correct answer. It was between 2 and 3. 2 and 3. The correct answer is definitely going to be number 2, a client who needs antibiotics for a GI infection. Check out the medication. It's an antibiotic. Can the LPN give that medication? Absolutely. That's going to be okay. This is the most stable client. The client who has severe anemia due to a placental detachment, that is going to be an unstable patient. That patient is unstable. That patient's going to need a lot of evaluation, assessments, and we're not going to have the LPN be the primary for that. All right. As well as the other ones, they all require RN. They all require RN. Woo. Yes. Also, I like that, Lelaine. What are you doing here? What are you doing here? It's good to see you. That anemia might need blood transfusions, and we're not going to have the LPN initiate those. All right. I'm glad you guys are feeling smart. Some of you guys, hey, you might need to ask yourself this question. How often do you take a break when you are studying? How often do you take a break when you're studying? Because right now, I think it's break time here, Remar Review. I need to pull you guys back, and we need to take a break. Hey.
No, listen, you need to take a break.
Okay.
Because I've been watching from the sideline, and you've been killing it, girl.
Yeah.
NCLEX questions left and right. I'm like, oh man, listen.
The team is here.
Listen, so I have something for you.
Okay.
This is a water challenge reminder.
Oh, here we go. And the Remar Cut water challenge reminder. So what are we talking about? What y'all taking? What we taking a break about?
Big steps, guys. Big steps. I would love to see if what I want to do is I wanted to see you guys' progression with the water challenge.
Wait, who are you?
My name's LeBron.
Team Remar.
Yeah, Team Remar, LeBron.
Yeah.
Team Remar here.
Good.
So what I wanted to see is you guys' progression with the water challenge. So just wanted to check in on you guys.
Mm-hmm.
So see these awesome Remar cups, and let me see the brand.
Yes.
I want to give you guys, at least 5 of you guys, one of these cups for free. What I want you to do, it's cool, right?
That's really good.
Okay.
Yeah, nobody has these cups. Nobody has these cups.
Nobody. So what I want to see you guys do, I want you to post your chart filled up to today. We'll fill it up to the 14th because the 15th isn't done yet.
Okay.
Yep.
So to the 14th, your experience with the water challenge, and I want to see that on the main page of the Remar.
So not the group, but the main Facebook page.
So the first 5 people we see with that post, with their chart and the experience of what they had with the water challenge, will most definitely get one of these.
Kathy said yes.
Yeah, some people are ready.
Right?
People are ready. So that's really cool then. You guys, we started the water challenge April 1st. It's April 15th.
Yep. So we're 2 weeks in.
Yep. So
2 weeks in.
Post your progress.
See what your skin is looking like.
Also, your experience, right? You want to know how you've been drinking it, what's it like, and you will get the cup, the Remar cup. But you got to do it fast because we're looking for the first 5. All right? First 5.
I think we're at the end of our study break, but I got one more surprise for you. Haven't even told the crew.
What is it?
At Remar Nurse University.
Yeah.
We got an amazing surprise for you guys. Because we like to celebrate success.
Yeah, we do.
I can't tell you what it is now, but it has to do with water. I'll see y'all later.
Are you going to tell us later on?
Ooh.
Are you going to come back and tell us?
No, are we? Should we?
I don't know what it is.
It has to do with, oh man.
What is it?
It has to do with water.
Water?
Water.
Oh God.
It's a celebration.
Are we giving water away?
We're gonna do something great.
We are?
Yeah, on the water.
Oh, look. Okay. All right. Okay. LeBron, people want the chart. They say, where can I get the chart today?
Put the link.
I'll put the
link on this post.
Yep.
Okay. Link on this post. Okay. Whew. All right. That was a good study break. Drinking your water. Thank you, Mark. Thank you, LeBron, for the water. I like these cups. So you can have the opportunity to get you a Remar cup. All right, let's go back. All right, so you guys understand the water challenge rules. Go ahead, get your chart filled out, post it to Remar for NCLEX, and just talk about how drinking water has changed your life. Look, they want to know about the water. Is it a boat cruise? Somebody said, ask, are we going back to Jamaica? Are we going back to Jamaica? Oof, that would be so nice. All right, let's get back into a Remar nurses. Your study break is over. It's over. Here we go. All right, so let's do some more NCLEX questions. And these are going to come from the NCLEX Ready question bank that Remar Review has. Their NCLEX Ready question bank. All right, so Mark, they're calling for you back again. See, this is what happens when Mark gets on. I know, you guys got to see, when Mark gets on, then you totally forget about me. And I got to get you guys focused again. Here we go. All right, so we're going to do a question here. Here we go. First question is this, and I want you guys to try to get every one of these right. Let's go. The nurse assesses an older client in an assisted living facility who is crying uncontrollably and who tells the nurse, I am going to be evicted because I ran out of money to live here. Which of the following is the priority response by the nurse? Number 1, I am sure something will work out for you. 2, can you ask any of your family for money? 3, you will qualify for Medicaid now that you have no money. Or 4, there are other financial options available to you. Here we go. We got a client, they're crying uncontrollably. They live in assisted living. They say, I'm going to get evicted. I have ran out of money to live here. What is the best response by the nurse? Number 1, I'm sure something will work out for you. 2, can you ask any of your family for money? 3, you will qualify for Medicaid now that you have no money. 4, there are other financial options available to you. All right, here we go, Remar nurses. I see the answers coming in. It's a unanimous. Is it unanimous? I think it is. The correct answer, you guys got it. Number 4, there are other financial options available to you. There are other financial options available to you. The reason why the other ones are essentially untherapeutic is because they are not facilitating dialogue appropriately. Like the client is in need of compassion, in need of empathy. So if we look at the other choices, number 1, I'm sure something will work out for you. That's not acknowledging the patient's feelings at all. That's actually ignoring what they just said. Number 2, can you ask any of your family for money? No. That is not going to be therapeutic, okay? Because if the answer is, no, I don't have any family. Like, no, that's why I'm in assisted living. I don't have anybody, that can create an even more negative interaction. So you have to be careful about even leading questions, all right? All questions are not good questions. 3, you will qualify for Medicaid now that you have no money. What? Is that a fact? Is that false reassurance? How do you know? Like, we're not taught the art of Medicaid. We don't know all the stipulations. So you definitely would not want to present that. But 4, there are other financial options available to you. Now that is a reasonable statement. That is going to give an acknowledgement to the concern that you've run out of money, right? To our patient has run out of money. So we can't sit and say for sure what the financial option is, but there are options available. All right. Let's try another one. You guys did excellent on that one. Pretty much everybody that I see here has gotten it right. Okay. All right, here we go. Number 5. All right. The nurse is conducting a health fair at a local high school on reducing high-risk behaviors. Which teaching should the nurse include in the presentation? Select all that apply. All right. So we are talking about a high school health fair and how to reduce high-risk behaviors. So number 1, what are we going to include? Select all that apply. Always buckle up, even for a short trip. 2, use approved bike helmets for bike riding. 3, do not drive for 1 hour after drinking alcohol. 4, condoms offer full protection against sexually transmitted infections. 5, dive into untested waters with hands fully extended over the head. Okay, so we're looking for things that are going to reduce risk for these teenagers, for these high schoolers. Which ones should we pick? And this is a select all that apply. So I'll tell you that 1 or more answers may be correct. 1 or more answers. All right. So the options are, for those who are listening from on Remar Nurse Radio, number 1, always buckle up even for a short trip. 2, use approved bike helmets for bike riding. 3, do not drive 1 hour after drinking alcohol. 4, condoms offer full protection against sexually transmitted infections. And 5, dive into untested waters with hands fully extended over the head. Oh, this select all that apply question, kind of tricky from what I'm seeing. Here are the correct answers. It's just 1 and 2. Yes, it's just 1 and 2. We're teaching high schoolers. We have to teach them things that are sensible and that make sense. 1 and 2 are the only ones that make sense to me. Yes, you want to buckle your seatbelt, even if you're going just down the street. Okay, high schoolers, you're driving, you're new to driving, you need to have your seatbelt on at all times, period. 2, the second one was using a helmet when you're riding your bike. We have a lot of high school students who ride their bikes. So we want to promote helmets. It's another form of safety. The other ones are just not going to be appropriate to teach. Okay, do not drive 1 hour after drinking alcohol. Some of you guys picked that one. Now, what's the issue with that? What's the issue with telling a teenager, don't drive just 1 hour after drinking alcohol? Well, what if they say, okay, well, what if I drink and I wait 1.5 hours? Then I'll drive. You know, teenagers can be very literal. They look for excuses to do silly things sometimes. So that's going to be not appropriate, okay? And it's okay if you got it wrong. You're here to learn. Questions are not here to teach you anything. They're here to show you your weaknesses. So if you misread that, you got it wrong, that's okay. That's the reason why you're here. 4 says condoms offer full protection against sexually transmitted diseases. Sounds good, right? But it's not true. Condoms don't. There are many STDs you can get even while wearing a condom. You can get HPV, you can get crabs, you can get, listen, somebody has a sore, you can get the herpes. All right. So that one is not going to be, that's not going to be appropriate. I like that. The teenagers shouldn't be drinking anyways. That's number 1. How about we start there instead of telling them how to drink and drive? Just don't drink at all. All right. 5, diving into untested waters. Why? Why would that be on the list? Like, if the waters are untested, don't dive into them, please. Whether your hands are fully extended or not, don't dive into untested waters. So that was the correct answers for question number 5. Let's move on. Question number 6, we have here this scenario. All right, we have a nurse has received 4 messages from the call-in clinic. Which client should she call back first? All right, this is some prioritization here for you. A nurse has received 4 messages from the call-in clinic. Who should she call back first? Number 1, the client says, I'm taking losartan to lower my blood pressure. 2, I break my verapamil SR in half to make it easier to swallow. Okay. 3, I try to avoid sudden position changes since I'm taking hydralazine. Or 4, I will not use any salt substitutes since I'm taking captopril. Here we go. Who should the nurse call back first? Number 1 says, I'm taking losartan to lower my blood pressure. 2, I break my verapamil SR in half to make it easier to swallow. 3, I try to avoid sudden position changes since I am taking hydralazine. 4, I will not use any salt substitutes since I'm taking captopril. The correct answer, you guys are doing phenomenal on this question. From what I see so far, just a few, but mostly everyone has chosen the correct answer. You guys got it. It's number 2. I will break my verapamil SR in half to make it easier to swallow. No, my friends. There are certain medications you don't want to alter the form. It's given in the form for a reason. So a medication that is SR stands for what? Everybody say it. 1, 2, 3. Sustained release. Yes. So if we break it in half, we are going to alter the longevity of that medication, right? So that means your patient will, they'll absorb it quicker and they won't have the expected effects of the medication, right? So SR stands for sustained release. ER stands for extended release, right? So any of those kind of medications, we are not going to alter the form that it comes in, all right? So sustained release, slow release, same thing. I like that though. Thank you for providing that. And so that was an easy question if you knew those letters. So make sure you check that out if you didn't get that one right, okay? All right, fundamentals. These are fundamentals of nursing, and I love them. Question number 7. Here we go. Number 7. After administering penicillin G to a client, how long should the nurse observe the client to monitor for an allergic reaction? Okay. Here are the choices. You need to pick the best one from the choices that you're given here. Number 1, 5 minutes. Number 2, 10 minutes. Share this video. Somebody needs to know this. Number 3, 30 minutes. Number 4, 45 minutes. What sayeth you guys? All right. Yes, you got to pick the best answer from the choices that you're given. Pick the best answer from the choices that you are given. I'm giving you time to marinate on this one because I see that some people, they're confused because they're looking for a choice and it's not there. Sometimes this happens. Sometimes you will be in front of the computer for NCLEX and you will not see the answer that you were expecting to see. Well, what are you going to do? Are we going to freak out and have a meltdown and waste time thinking, why isn't the answer I studied all these years there? Why isn't? Are you gonna react appropriately and pick the correct answer? Okay. What's the safest thing for the nurse to do? Is it to monitor for less time or more time or the standard time? What do you guys think? All right, let me give you the correct answer. It is going to be unsure. Bam! The correct answer is going to be 30 minutes. Okay, if you're given this scenario where you have these choices, you want to go with the longer of the periods, okay? Because 15 minutes is not going to be there. So you're going to have 20 minutes or you're going to have 30 minutes. You're going to have 10 minutes, you're going to have 30 minutes. You're going to have 18 minutes, you're going to have 25 minutes, you have 30 minutes. Go with 30 minutes, okay? Because an allergic reaction can happen anytime within the 30 minutes, all right? Now, yes, when you study NCLEX resources and when you look in books, it'll say 15 minutes. And that is how long the nurse should physically be in the room, right? So you're physically in the room for 15 minutes, but the duration of your observation should really be the entire time the blood is running or the entire time the medication is given. However, that first 30 minutes is really crucial because yes, you can leave after 15 minutes, but you're supposed to come back at that 30-minute mark. So within another 15 minutes, you should be back there looking at the patient, making sure that nothing has popped off, right? The student workbook, yes, I prepare you guys. All right, so here are some notes on like penicillin, okay? Just to make sure a quick overview. All right, a quick overview. All right, so penicillin in general is great. It's used to treat things like pneumonia, syphilis. I also go over this in a DVD program. You guys know pneumonia is great for those STDs, okay? Gonorrhea, syphilis. It also, in the quick facts, is used to treat Lyme disease. All right, it can be used with doxycycline to treat Lyme disease. Now, penicillin can also be used as a prophylactic or it can use to prevent rheumatic fever, okay? Rheumatic fever. So think about this medication is for large, very powerful infections, all right? This is not the medication that you're just going to give when somebody has, you know, a small kind of infection. Like penicillins are going to come into the body and they're going to destroy any kind of foreign bacteria, right? Good or bad, whether the bacteria was placed for your benefit, penicillin is going to eradicate it. Whether the bacteria is harming you, penicillin is going to get rid of it. All right. So that's the thought when somebody is prescribed penicillin. Let me ask you this about penicillin. I don't think I've ever asked you about this before. Does penicillin cross the placenta in pregnant women? Does penicillin cross the placenta and enter into the breast milk? What do you guys think? Does penicillin, because if that's the case, is it safe to give during pregnancy? Like, and that's kind of what I want you guys to think about. Like, whenever you're studying some pharmacology, you definitely need to know the implications for pregnancy, whether it's safe or not. NCLEX likes to ask a lot about that as well. So here's the answer to that. Yes, penicillin, it does cross the placenta. However, it's still used safely during pregnancy. So that's something that you might want to know about the medication. All right. So it's still going to be administered to a pregnant client because so far it has not proven to cause any kind of harmful side effects to the fetus. Okay. So I thought that was a cool point just for review. I'm going back to the teaching though. Penicillin, because it doesn't discriminate between good and bad bacteria, penicillin will definitely cause you to have some GI stress. And when I say GI stress, I'm talking about it will mess up your gastrointestinal tract, okay? You're going to have diarrhea, you're going to have some nausea, because again, the penicillin is going to work throughout the body. So you have bacteria and flora that helps you to process and digest food appropriately and store food in your intestines. When that bacteria is not in the intestines, you're going to have issues with diarrhea. And so that's one of the first side effects that patients will complain of when they're given a regimen of penicillin antibiotics. Now, when you're administering penicillin, it can cause injection site pain and irritation if you're giving it IM, or even if you're giving it IV, sometimes it can cause a phlebitis to your patients. Of course, penicillin may also decrease the effectiveness of oral contraceptives. So patients will have to do something differently while they're taking these kind of antibiotics. And we always tell our clients that even when they start feeling better, which usually clients will immediately start feeling better once the penicillin is on board. I love it. I love penicillin. I think it works very fast, especially amoxicillin. You still have to make sure that you take all of the regimen, all of the scheduled medications. And I don't know about you guys, but just being honest, that's like one of my biggest points about taking medication for myself, because usually once I start feeling better, I don't want the medication in my system. I don't like it. But you definitely have to teach your patients to take all of it, and teach yourself too. Okay. All right. Let's see here. Do I have another question? Yes. Okay. I have last question coming up here. I believe this is the last question. Here we go. A client with unstable angina. What's going on with this client? Receives routine applications of nitroglycerin, okay, ointment. Now, the nurse should delay the next dose if the client has what? Number 1, atrial fibrillation. 2, a systolic blood pressure below 90. 3, headache. 4, skin redness at the current site. What would make us hold that nitroglycerin ointment? What would make us hold that nitroglycerin ointment? Okay. It is going to be, oh, you guys got it. I'm not even going to delay this. This was the fundamentals review. Yes, of course. Be careful, guys. The correct answer is number 2, a systolic blood pressure below 90, because nitroglycerin is a vasodilator. So if the blood pressure is low and the vessels open up even more, that's going to bring that nitroglycerin, that's going to bring that blood pressure down even more because of the effectiveness of the nitroglycerin. So I wanted to end on this point because this is basic foundations, okay, of medication. That pharmacology. You have to know that. You have to know the whole parameters. So if you chose number 1, atrial fibrillation is not contraindicated for nitroglycerin use, okay? Also, the headache is a common side effect, but you would not hold it because of the headache, all right? Let's see, what else? 4, redness at the current site. Well, if it's a nitroglycerin ointment, remember that you are supposed to be doing what to the sites? Are you putting it back on the same site? Are you doing it, or are you what? You're rotating those sites. So that should not ever be a reason why you wouldn't apply a new dose of ointment, because you're rotating those skin sites, okay? You're rotating those skin sites. Now, remember, I'm not talking about the heart rate here. You guys have to read it. The systolic blood pressure is what we're talking about, and that's 90, okay? That's 90. Now, the heart rate is different. Okay, guys. So that is your Let's Talk NCLEX. I do want to take some time and talk about Remar Nurse University. I'm getting a ton of questions, so I want to do a question and answer set. Mark is going to come back up here, and we are going to help you guys to understand how Remar Nurse University is going to work for you, because this program is for you. Before I go, I need to go into that. I need to do, we're paying for NCLEX. I have to announce the new winner for this week. She is going to be so excited to have won. She's going to be so excited to have won. It is going to be from New York, representing Nurse G. Anangwo. And I'm going to be getting her NCLEX exam paid for. Future RN. She purchased the DVD self-study package just last week. Yep, she purchased it last week. So she will be receiving her NCLEX review paid for just by investing in herself. And so we are looking for a new winner every week. Congratulations to you. Congratulations to you. Okay, so this is going to be FAQs about RNU, FAQs about RNU, FAQs about RNU.
Hey.
And I'd like to bring up a stranger to you guys. I don't even know if you know who he is.
Hi, guys.
But this is Mark Callion, and he happens to be very instrumental with the Remar Nurse community, very instrumental in my life personally, the greatest guy that I know on this planet. Will you marry me?
Every time.
All right. So we're going to talk about Remar Nurse University.
Yep.
Remar Nurse University.
And so if you have any questions about RNU, Remar Nurse University, feel free to ask them.
Okay.
I will try to do our best to answer everything. And if we can't answer it now, we'll make sure we put it in a post separately or on the website.
Perfect.
With like an FAQ section so that you have
Right.
all of the information that you need about Remar Nurse University. So Regina, first off, tell us what you're holding in your hand.
Okay. I see the questions. Thank you, guys. I am holding the workbook for this event. This event will be the entire month of May into June. So every Monday night, right? Every Monday night, you can watch this class for free on Facebook or YouTube. There will be no cost. You can watch it for free and do with the information whatever you want. And I'm bringing.
So you get your notebook.
Yeah,
ready,
you can get buy your own notebook. Don't even look at this one. If you don't want to spend anything, you just want to watch the class. If you just want to watch me, you can do that totally free.
Just
okay.
like you're doing right now.
Just like you're doing now.
Yeah.
All right. However, there are some people that just want to take it to the next level. They want to actually participate. They want to be active in the class. They want to be, following along, doing the homework, everything like that. Then we offered to purchase the workbook that goes along with the class, right? As well as a Remar Nurse t-shirt that I'm wearing. All right. And this is the one. Thank you. This is the one that I'm wearing. I just put blue sleeves underneath it because I was a little cold today. But it's a short sleeve t-shirt. And this workbook, the bundle was just $25, right? It wasn't, and basically that's just the cost of us, the material for real, guys.
To the movies,
yeah, seriously. The workbook, you get a workbook, you get the shirt, and we're sending these out today. I saw somebody say, when am I getting my workbook? Mm-hmm. This is going out today. If you purchase the workbook, they're going out today. So expect to get them Thursday of this week, all right, which is plenty of time. The class doesn't start until, the first one is until May 6th, okay? So
you're missing something now. So you get the workbook, you get the t-shirt,
that's true,
and an additional $50 discount for the DVD self-study program.
Absolutely.
So it's really like the bundle and save package, right?
Correct.
So if you want to get $100 off the DVD self-study, just get the workbook, get the t-shirt.
Exactly.
RNU.
Right, I forgot about that.
Absolutely, see?
So, yes. So I'm telling you guys, I think it's an amazing value because the bundle does get you $100 off the program. I want to talk a little bit about the DVD, not the DVD. I want to talk about the Remar Nurse University. Okay. The way you get it is when you sign up for the event, and there's a link on the page. All right. There's a link on the page for you to sign up for RNU.
So at remarnurse.com, you go there, you'll see all of the links to be able to sign up. And even if you have any trouble signing up, even there's a FAQ that says, hey, let me sign up.
Yes. So So on remarnurse.com, you will be able to sign up. As soon as you put in remarnurse.com, Remar Nurse University is the first thing on the website. And you can choose to participate by just watching it, or you can choose to purchase the bundle, which is the book and the shirt for $25. So if you go to remarnurse.com, you can get this workbook.
All right, we have a question here either from Brenda. In fact, some of you were asking the same questions and saying, hey, I already have the DVD self-study program. Do I need to get the workbook? So the answer is absolutely yes.
Absolutely yes.
So the workbook for RNU is considered an advanced study session. So what Regina's done is taken the concepts and the topics from the DVD self-study program and enlarge them to take them to the next level of tier 2, tier 3 type questions of thinking to enhance your critical thinking.
Yep. So there's a difference between the things in RNU workbook and your DVD workbook. But my goal is that you guys, everybody will have the DVD self-study package, and you'll be able to build on it from what you learned in Remar Nurse University. And if you don't have the DVD self-study package, that's okay. I'm going to show you here how you need to be studying for NCLEX.
That's not okay.
Well, it's not okay.
Get the package,
you can,
get your license, do what you have to do.
You'll be able to participate, but I want you guys to see literally what content review looks like. Okay?
Because there's a difference.
So, when are you coming to New York? So in the calendar, in the workbook, I'm gonna say there is a calendar here of the cities that I will be in. Start with Chicago. May 6th, I'll be in Chicago. So I'll be doing the class. Somebody else asking, what time are the classes? The classes are going to be 7 p.m. Monday nights at the location I'm in. So
check the specific time zone of where we'll be on that night. So that also answers another question. Will Regina actually be at the classes?
Yes.
The answer is
yes, I will physically be there. You won't be watching a video recording of me.
It's not a watch party.
It's not a watch party. I will physically be in these cities.
Yep.
So
and everybody else will be able to watch it live online through YouTube or Facebook.
Yeah.
All right.
So these are the cities I'm going to. May 6th, I will be in Chicago, Illinois. Now, when you sign up for the event, it will tell you the location, the place where we're holding the class, okay? And this is where I will be. So I'll be May 6th, Chicago. May 13th, I'll be in Atlanta. The class will start Monday night, 7 p.m. Eastern time zone. May 20th, that very next week, I will be in Los Angeles, California. So the class will start 7 p.m. and that's Pacific Standard Time. May 27th, that's Memorial Day weekend, I believe. I'll be in New York, okay?
Coming out Memorial Day weekend?
Memorial Day weekend, that Monday, you need to be at this class, all right? It'll be 7 p.m. Eastern time. I'm expecting a large class in New York.
Yeah.
And then in June, actually, June 3rd, I will be in Miami, and that class will start at 7 p.m., okay? So if I miss the class, will there be a replay? If I miss the class, will there be a replay?
Do not let a week go by.
Okay,
that's
it.
I'm just gonna tell you that.
All right.
Do not let a week go by. It'll be live on Monday. By next Monday, it might not be there. I can't guarantee, but make sure that you check for it within that period of time. But this is live, and the idea is that at the start of RNU, your workbook, you get it, you're going through it, and at the end, you're building and building and building. So you have a tremendous amount of momentum preparing for NCLEX. Yes.
So everybody that is preparing to test soon, this will be that ramp. I mean, this will be that jetpack that you need. All right. Does the discount work only for the self-study? Yes, it's just for the self-study. Okay. It's just for the self-study for right now. All right.
Yeah. And so she says, because I'm graduating, I can just get the online academy. So it applied to that as well. So even if you're like specifically for our new grads, you can get the self-study program, especially with this discount, with this savings.
Yeah, it just makes sense.
Yeah, it really just makes sense.
Like this is a time of the year where we really discount we discounted like Black Friday discount.
May is NCLEX review month. And so we're taking care of all of our graduates, repeat testers, international students. Remar Nurse University is for you.
Yeah.
In fact, so even really, if you have a test date that's coming up a little bit sooner than later, if your ATT is expiring, don't even wait to order the package. Order it now.
Yep.
In fact, if you need to order it now, go ahead and use the code, listen very closely, RNU. Use the code RNU if you need to order now and get started. It won't be the same discount, but it'll help you out and get you going because we want you to get your license in time. And we know some of you have deadlines or testing soon.
Yeah, that's true. Some of you guys won't make Remar Nurse University.
Not to the end anyway.
Yeah, not to the end. And, you know, so if your ATT expires, I certainly don't want you to miss out on taking NCLEX. Yep. So just purchase the package. You can use that discount. It's not the same, but you can get the material and get started. That's
right. Somebody's asking, what is the cost for this class? I love to attend New York session. Now listen, to sit in a class with the #1 NCLEX instructor in the world should cost $1,000.
For real.
Like it really should cost $1,000 for like a 2-day or like, you know, $500 for one or something. But we love you guys, right?
Seriously.
And we believe in your success. We want to make sure that we're available, that she's available. So the cost for the class of New York, the cost for the class of Chicago, for Atlanta, for Los Angeles, and for Miami, the class is free, guys.
Yeah.
The class is free. If you want your workbook, if you want your T-shirt, if you want your added discount, you can bundle and save for just $25.
Yeah.
But I'm telling you, like whole entire classes, nursing schools are coming out. In fact, I saw a lot from Chamberlain, I believe.
Nice.
I think maybe it's like a Fortis or something, but yeah, we're looking at all of the numbers, and you guys are definitely coming out. So it's free to attend.
Yes.
It's free to watch online.
Oh my goodness.
If you want the full experience, bundle and save.
Oh man, and you guys, you don't know, like this is going to be life-changing for some people that show up to this class. There are some people here that have been struggling with this NCLEX for years. They can't get motivated. They can't find themselves studying. When they come to this class, that experience will no longer be an issue for them. They will be able to get their license. And just think about, you know, what would you pay to have your nursing license? Wow. Like, how much would you sacrifice to have your nursing license?
And not even how much you would pay, but how much have you paid already?
True.
Like,
true.
I mean, testing, retesting, nursing school. I mean, it's all an investment.
Yeah.
And so our goal is to help bring that to completion. You're already invested. That's why you're here.
True.
So don't let, small obstacles or anything like that discourage you, or anxiety or fear or the what ifs. That's why Regina does the Monday Motivation and Let's Talk NCLEX, so you can see exactly what it's like before you sign up, before you get the review. If you like this and it's working for you, like imagine what's actually in it when you invest in yourself.
Absolutely. Right? And there was a comment where somebody said that they need more help. And I'm telling you, no matter what your situation is, how long you've been out of school, we have had people who have never attended Remar Nurse University and have been out of school for 40 plus years. Yeah. They get the DVD package, never have even watched the Monday Motivation, just heard about me.
In fact, they're still calling Regina Remar.
Yeah, they don't even know my real name. They just purchased the package and they say like, Remar, after 40 years, I passed. Boom. And so I'm telling you, come to the class, participate in Remar Nurse University, get the package, and you will find that key. Like I liked what Nurse Ronaldo said. It really is the key. Mm-hmm. And it's just having a holistic program where we not only address the content that you need. Yes, you need to know nursing content, but we're also doing, the spiritual side of it. We also, incorporate how to reduce anxiety. Like that is it. So I'm just going to say the calendar again so you guys can mark your calendars. May 6th, I'll be in Chicago, right? Illinois. May 6th, Chicago, Illinois. The class starts at 7 p.m. every night. May 13th, Atlanta, Georgia. May 20th, Los Angeles, California. May 27th, New York. And then June 3rd, I will be in Miami, Florida. Okay. So, and it's okay if you guys are not in one of these cities, you can still participate. You can still purchase the workbook and you just watch online. All right. You just watch online, and it's at remarnurse.com, and you will see how to register, how to purchase your bundle package. All right. Because I really want you guys to have the workbook. I mean, I didn't create the workbook just because I have free time. I did not have the time to do this.
How many pages are in the workbook?
That's a good one. There are 50 pages?
Yep.
Okay. Yeah, there are 50 pages in this workbook. It took a lot of detail for me to come up with like advanced clinical applications from the DVD self-study package. So just some things that I'll be going over.
Scroll back.
Yeah. Sure thing.
To the table of quarantine.
Ah, thank you.
Yeah.
Yeah.
One more.
Yep. Okay.
There we go.
Yeah. So, okay. So I will be talking about ethical implications for nursing, the legal issues in nursing. I'm going over blood gas interpretations. I'm going to talk about how to interpret them. You guys know, if you have the DVD program, I'm taking it a step up another notch by showing you guys how to interpret.
3 different ways, right?
Yeah. Well, I'm going to do, 3 different ways. I'm going to do the compensated blood gas interpretations for you guys. I'm doing that in Los Angeles. New York, we're going to go over the delegation. We're going to hit up that orthopedics. I have some case studies, some clinical scenarios for you guys. In Miami, I'm going over the EKG information that you need to know. We'll also be doing the final exams. Every class will have pre-class questions you can do ahead of time. In this workbook, I also have NCLEX activity pages you can do ahead of time, or you can do them with me. I'm going to go over them with you. It's just a great book. I think it will make the experience of RNing you so much better. And I do have interdisciplinary. I included that as well because I had got a request from it. Yep. So I don't even know, what day am I doing interdisciplinary? I'm doing it the same day as I do delegation. Okay.
Nice.
So I am so looking forward to this event. I'm just encouraging you guys, get the workbook because if you're taking NCLEX, there will be things in this workbook that I guarantee you will be happy that you have studied with us for the entire month of May.
I see somebody asking, where are the locations? So when you go to the website and sign up, you'll see each location. When you click on Chicago or LA, you'll see the exact location. I can tell you in a general idea that they're pretty much all downtown in the business districts and really nice locations. I think so. Florida is Miami is the Miami Beach Convention Center. LA is the LA Convention Center. So we have some really nice locations. New York, I believe, is at the Sheraton in Times Square. Yeah. And Chicago, I believe, is the Palmer House. It's the Palmer House. So that's in the downtown district. I mean, really great locations. And Atlanta is at the Intercontinental in Buckhead. Right?
Perfect.
Buckhead Intercontinental. Really nice spots.
Yes. So, so I will be there live. If you come to the event, you'll be able to do the event live with me. I'll be there to answer all of your questions. Mark will be there as well. People are saying for prayer. Mark will be there. The Remar team will be there. It's just going to be an amazing tour for our nurses here domestically in the United States. We travel all over the planet doing NCLEX reviews. So Remar Nurse University is kind of domestic.
Gabriella asked the question. She says, Nurse Regina, she says, do you work in a hospital or is this your job? You spend so much time with the Remar nurses, and I'm not complaining.
Right. No, I do NCLEX prep full time. It is my passion, is what I do. Helping nursing students pass NCLEX. That is what Remar Review is built on.
You take NCLEX. I mean, so people study for NCLEX typically once in a lifetime. This is your lifetime of studying for NCLEX.
Yes, this is it. So when I prepare for you guys, I know a little bit about the NCLEX exam. So I just want you to make it your business to be here. If you're serious about passing NCLEX, then you will make it your business to be here. Okay.
Congratulations, Como. I passed NCLEX.
Nice.
Awesome. That's what it's about. You should get your license. Hold on. Here's another one.
Okay. Remar, I want to say thank you. I finally passed my NCLEX RN March 29th, had 243 questions. Woo. And ran out of time. Wow. You guys have to get the full package. It is the real deal. Love you, Regina and Mark.
Awesome.
Woo. Awesome. You ran out of time and passed.
Says get the full package. Now listen, I don't know if they got a discount when they ordered,
right?
But they got the full program, paid full price, and now they got their full license. And that's what it's about, is getting that license, guys.
What is the workbook title, please? It just says basically on it, Remar Nurse University. So it has my face. It's different from the other books, and it's specifically for this event. Get this event because we will not have. Get this workbook. We won't have a PDF version of this book going out anywhere. It will have to be physically shipped to you. So don't wait as well. That's one thing. Don't wait, because when we leave to travel, then you want to make sure that you have this book on the day of your class. Okay. All right. So anything else about Reed Martin University is coming soon. It starts the first Monday of May, and it will go on until June 3rd, every Monday. And the class will be about, I don't know, about 2.5 hours. At least if you come to the live locations, it might be a little longer. We might, start earlier. I'll be there. So don't skip out on this experience. Absolutely. Don't skip out on this experience. Absolutely. So that's Reed Martin University. Right. Get your t-shirts. They're rolling out. The workbooks are rolling out. Good stuff. I can't wait to see you guys with your t-shirts, taking pictures with the workbook. I want to see you guys. I want you to wear your t-shirts to the class. That even be awesome. Wear your t-shirts to the class.
Yeah, you have to wear your t-shirt to the class.
Exactly.
Absolutely. Also, if you do the bundle and save and you're coming to one of the live locations, you will receive a ticket, which allows you to have priority seating. In other words, you'll be able to get into the event a little bit sooner. Okay. So that way you can meet, greet, mingle, and have your choice of seating at that event as well. So,
right, because we have like hundreds of students.
Yeah, you got to actually order more shirts.
We do?
Yeah, we had 600 to start off with just to say, hey, we know how it was going to go.
Right, that's
but
true.
Those are actually gone, and so we need to order some more. So
yeah, more. And we just got like our first order of the workbooks came in. So please don't wait to get your workbooks. I think they're already sold out for what we have. So get your orders in.
Make sure you have enough time before the class.
Oh,
hey, hold on. Como says, hold on. I want my Reed Martin shirt. I'm wearing my t-shirt to go see ET in Chicago this month. Shout out to Dr. Eric Thomas.
Yes, we love
Chicago,
him. Yes.
April 27th, I believe, for the 1%. Como, if you see Dr. Thomas, give him a big hug and let him know that you are a Reed Martin nurse.
Yes.
Actually, I just talked to him yesterday.
Yeah, we were. Yeah.
So we love Dr. Thomas as well. So if you guys don't know who he is, go to YouTube and or just Google ET Inspires or ET Motivational. All right.
Yes.
Love it.
Nice. So how can we get seat reserves?
All right. Everybody who does the bundle and save and is coming to the live class, you'll have early admission. So it's not, a seat with your name on it, but you're going to be able to get in a little bit earlier.
Yeah.
And so that you'll be able to have your choice of where you want to sit and make all that come true. So,
we
want to see you front row with your t-shirt.
Yeah. And just so you know, I'll probably be up in front. So I just want to say that I'll probably be teaching from the front of the stage at these events. And they're like huge events. Like we have like the convention center. We're expecting a lot of people to be there. Okay. We expect a lot of people to be there.
That's why we got the convention center.
Yeah. So make sure that you come out, make sure you get your tickets
and listen,
and get in.
If you're in nursing school and you are the only one that comes to this thing, like shame on you. Like your whole entire class should be at this event. Your dean, your professor should be at this event because this is the best thing for NCLEX, period. You guys know that. You guys already know that. Even if you're not coming to the live class, we want to see you online just like you're watching now. Even if you're not coming to the live class, you can still do the bundle. So you get your workbook, you get your t-shirt. And so we want you to wear your t-shirt as well on that night, on a first night or whichever night, Monday night that you're watching. So we want to see you checking in as well.
Gilly said, how early can we come?
When you sign up, you'll receive all of that information by email.
Okay.
Yeah. You'll receive that information by email when you sign up. Those emails will be going out pretty soon.
Yeah, and I'm super excited because the event is on Monday, but I'll be coming to the cities, I think that Friday, because I do want to go to church in every city. Yep. And so I'll be there at the event and it's going to be, I'm just looking so forward to going to Chicago, Atlanta, Los Angeles, Miami. Yeah. Oh my goodness, New York is going to be crazy. I've gotten the bundle and saved. Do I still get the $100 off? Yes,
Absolutely.
You do. Yes, you do.
Absolutely.
Yes, you do. All right.
Also,
is this for LPN or RN? That's a great question. I designed Reed Martin University to be for both. The LPNs, I think they will benefit from the delegations aspects of it. I think they'll benefit from every lecture. The RNs, you guys, I'm pressing you guys to really critically think. I'm pressing the LPNs to critically think too. But the RNs, you cannot just know definitions and pass NCLEX. You have to be able to apply this information to clinical scenarios. And so that's kind of where I want to focus you guys. It's kind of where I want to, steer your minds to is, like you said, like I said, if you have the DVD package, you have the content. You have it. So let's make sure that you have it by doing this workbook.
Absolutely. Somebody's asking if we ship internationally. So with the international shipping, it's a little bit different in terms of the bundle and save package. So we want to send you out your workbook. But for international, it would be an additional cost for the t-shirt.
Yes.
So for $25, you're able to get the workbook for the class. And that really doesn't even cover the cost of shipping for us.
You guys know that.
Yeah, shipping for international, it can be costly. So for $25, you will get your workbook. We'll send that out to you. But the t-shirt, it will be an additional charge, which we can send you an invoice for if you would like. But we at least want to make sure that you have your workbook and go from there. So
okay.
Yeah.
All right. Yeah. So this is what this is the gift that we have for you guys. I mean, Remar Nurse University, the entire month of May, like I said, it's something that we put a lot of work into. The content is going to be legit.
Yeah.
The content that I'm going over, you guys, you're not going to want to miss it. Okay.
Only thing that's missing is you if you haven't signed up.
Yes.
Right?
If you haven't signed up.
I love it. I see a lot of you guys are inviting us to the church.
Nice.
To the church in your city. So we love it. We're going to go through these and see where we can end up.
Okay.
Awesome.
All right. So my question is, what she said?
I think she said she signed up.
She signed up. I don't know the location. Can I come to the live classes since the location was revealed? I live in Brooklyn. Yes. Actually, it's free to come to the classes.
Yeah.
Okay. It's free. The classes, if you want to come to the class at any location, if you decide, hey, I thought I had to work, I don't have to work, I'm in Chicago, let me go to the class, it's totally free for you to go. Have your workbook, come on down to the class. This is where I will be giving the information live. And, our goal is to have it up, broadcast, streaming, everything perfect. Like, we want that experience for you guys at home, but the people that are at the class will definitely get the information. Okay. Because I will be there live teaching it. So make sure that whatever excuses that you can, find yourself to keep yourself in, it's nice weather, come out, see me, at the class.
If it was a blizzard, you need to be. Absolutely.
All right. Hey, Nurse Smith. She said, loving my life as an RN. Thank you for coming back, Nurse Mandy Smith.
Absolutely.
To let us know that you are still enjoying your RN career. I love that. All right. Is this worksheet DVD different from the former package I brought last year? Yes, this is not included in the DVD self-study program. This book is an advanced study session. Okay. So congratulations to you guys.
All right. If you guys like everything that you heard about RNU, definitely go ahead and share this video to invite others, because when you share, everybody else gets the information as well.
True.
And so we don't want to keep all of this good stuff to ourselves. We want to reach as many people, as many nurses as possible. Absolutely.
The bundle, again, is $25 for your t-shirt, your workbook, your ticket, your priority seating.
And an added discount.
And $100 off the package. Okay. So I will see you guys Monday. Again, we'll do it again for Monday motivation. Also, as well, if you have any questions, you guys know my email is right there. Bam. Support at remarreview.com. But get your workbooks. They're going like hot cakes. All right. They're going like hot. They're going like hot cakes. Make sure that you have yours ordered so that you can get it before the class starts. All right.
You guys know the motto.
Yeah. We can, we will, we must pass NCLEX. See you guys later.